Hi guys, welcome back. In today's episode, we're going to talk about another very common SIBO symptom, anxiety. We're going to talk about why it happens and, of course, what you can do about it. Stay tuned. Let's start off by talking about the two main routes or highways that the gut and the brain use to communicate with each other. So first and foremost, we have the brain, we have the gut, and there are neurons whose nuclei live, or the cell bodies live in the lower part of the brainstem. And then they go out and they innervate or synapse with all the parts of the GI tract. So this is the vagal nerve nuclei, and this would be the vagus nerve. So if we were to bundle that all up and label it, we would call that the vagus nerve. So the vagus nerve is connecting the gut and the brain from a physical anatomical sense, right? You actually have this structure connecting the two of them together. And the cool thing to know about the vagus nerve is that about 80 or 90% of the neurons of the vagus nerve are carrying information from the gut up to the brain. And only about 10 or 20% of these fibers are carrying information from the nervous system down to the gut. So top down, that would be things like telling the stomach to make stomach acid, telling the pancreas to make pancreatic enzymes, telling the liver to produce bile, and telling the gallbladder to contract to release that bile. It influences things like the immune system and the liver. Again, anything from about here to here, right? From esophagus up until about the last third of the colon, anything from here to here is going to be influenced strongly by the vagus nerve and controlled by the vagus nerve. So vagus nerve really is the neurological show as far as like the gut-brain axis goes. However, there's another route. If chemicals that we're going to talk about are not hitching a ride via the vagus nerve, because that does happen, you actually have chemicals that are produced by your gut microbes or the cells of your digestive tract, and those molecules can literally hitch a ride and go upstream to the vagus nerve and then into those vagal nerve nuclei and then the central nervous system. So if those chemicals are not hitching a ride directly on the vagus nerve and going through the direct route into the central nervous system, you can have other chemicals that are going to be connected via the bloodstream. So here's just a really floppy, loosey-goosey looking artery or vein, and I'm just going to label that blood. So we have two possible highways. One is a bit more direct, right? The nervous system connecting down into the gut itself, so you can hitch a ride via the vagus nerve and get direct access into the central nervous system, or you can take a slightly more roundabout route, and some of these chemicals can get absorbed by the bloodstream, and then they may or may not pass by the brain, and they may or may not get absorbed by the brain. Now, the thing about this is that only so many chemicals are probably going to be picked up by the vagus nerve, so this is not going to be every molecule of everything in the gut. And similarly, not everything that resides in the bloodstream gets a free pass into the nervous system. So for example, your nervous system, your brain, has its own set of immune cells. They never leave the brain as far as we are aware, and they just camp out there and they do their thing, and then the immune cells in the rest of your body stay out in the rest of your body. So like an immune cell that lives in your big toe will never reside in the brain and vice versa. But even if the cells, like let's draw a little white blood cell here, a little squiggly. Even if this white blood cell can't go into the brain and stir up trouble directly in the brain, the chemicals that it produces, called cytokines, can usually pass the blood-brain barrier and then affect the brain. And this is part of why we see things like sickness syndrome. So like if you have the flu, as an example, and you're very, very inflamed, right? Everybody knows what it feels like to have the flu. You're achy, your muscles ache, your joints ache, you have a headache, you just feel blah, you have low energy, and oftentimes there's just this feeling of blah and almost like a depression. Well, that's sickness syndrome. That is a whole lot of these cytokines, a lot of these inflammatory molecules that are swimming around in your bloodstream, and they are affecting the brain. They're affecting your nervous system and therefore your behavior and your mood. So just like you can feel inflammation in your joints or your muscles or your GI tract or with a headache, you can actually get inflammation of the brain, and you can feel that through changes in mood or changes in energy or just that general feeling of malaise and blah. So this is one route. You can have an immune system. So let's say, for example, in the case of SIBO, or perhaps otherwise via dysbiosis, you can have some dysbiosis or SIBO or candida in the GI tract, and then the local immune cells, remember about 70% of your immune system lives in the gut, these local immune cells freak out and say, OMG, there's dysbiosis, there's inflammation, there's SIBO. They send off the SOS signal, and now we have immune cells floating around in the bloodstream that are going to hang out in the bloodstream and then go throughout the body to send that signal, that SOS, and stir up more of an inflammatory response, because it's like a mayday. It's like your body, your immune system needs help, and that inflammation is the mayday SOS signal that your body is sending out for help. So we can have this indirect mechanism where the SIBO or dysbiosis instigates a local immune response, and then that triggers a broad inflammatory immune response, and now that will affect the brain and cause anxiety or depression or other sickness behavior. Or we could have the same thing going on. We could have a dysbiosis or a SIBO situation, and the immune cells that live right on the lining of the gut can send signals to the vagus nerve, and then some of their cytokines and some of their metabolites might get picked up by the vagus nerve and then hitch a ride directly into the CNS. So that's a possibility. There's also the possibility that the microbial metabolites that are being created by SIBO are hitching a ride either on the vagus nerve or the bloodstream, either one. So let's say, for example, if you have bacterial overgrowth in your small bowel, if you have SIBO, and a lot of those bacteria, let's say, are gram-negative, as they often are, and then those gram-negative bacteria, like E. coli and Klebsiella and Pseudomonas, those are going to throw off something called LPS, aka endotoxin, and now that endotoxin will cause local inflammation, certainly in the gut, but then that endotoxin can get out into the bloodstream, and it can perhaps hitch a ride on the vagus nerve, go up to the CNS, and now you're off to the races, and you have an inflammatory barrage local in the brain. Another thing that I see very commonly, which is kind of the flip side of that coin, you can have too many of the bad metabolites, like LPS, being made by bad bacteria in the case of SIBO, but you could also have a raging deficiency of the good stuff that your good microbes normally would be creating. And I see this very, very commonly in SIBO patients, because most of my patients, when they start working with me, are on low FODMAP, SCD, low FODMAP SCD hybrid, super, super low carb, biphasic. They're on some sort of restricted SIBO diet when they first start working with me. And then guess what? Now you've got some dysbiosis, and you're starving the good bacteria in addition to the bad. And now you don't have enough of the good stuff, like short-chain fatty acids, like butyrate and acetate and propionate, the normal good things that your microbes should make for you. Now you're going to have a deficiency. So normally on a day-to-day, you should have some anti-inflammatory signaling going up the vagus nerve or via the bloodstream to your brain. So now you not only can get in the situation with SIBO, where you have a deficiency in the good signaling and an excess of the bad signaling from your microbiome, because you have this imbalance between the good and the bad. It's not just about quantity, even with SIBO. I know that the word SIBO and the word overgrowth really makes you think that, but it's a skewed relationship between the good and the bad. It's a skewed ratio. And both of those things will contribute to inflammation and then quite possibly anxiety. Now, the last little piece that I wanted to throw in here is that, yes, we can talk about inflammation and its effects on the nervous system as it relates to microbial metabolites, and we can talk about it as it relates to things like the immune system getting involved and the cytokine response to that inflammation. There's also the added layer of gut peptides. And what I'll do is, it's actually too much of a beast to summarize in a video. I will link a couple of articles that I thought were especially useful. I'll try to remember to put them in the first comment and the description when I post this video. But there are a lot of gut peptides that are made by specialized cells in the GI tract, things like CCK and ghrelin and GLP-1. And these compounds can also potentially hitch a ride on the vagus nerve or go out into the bloodstream. And then similarly, those compounds, those peptides that your body makes, in response to food and the microbes and the microbiome, those peptides that you made now can go up and influence the brain and the central nervous system. And again, influence things like mood and anxiety and your stress response. So it is a big old tangled web. There's no like one simple answer to this, but what I will tell you clinically is that anxiety is very common amongst people with SIBO, or it's just the people that I tend to work with for some reason. But I have noticed across the board that a lot of my SIBO patients and a lot of my IBS patients have wicked, wicked anxiety. But I have also seen really profound improvements where patients with very severe anxiety, like 10 out of 10 anxiety, have had marked improvement in their anxiety within the span of a couple of weeks or a couple of months of working on their gut. I remember one lady, when we sat down for our first appointment together, you guys know me, right? Like, I'm not scary, I'm not intimidating, I'm very welcoming in my appointments. Like, we kind of chill out, and I try to make it a very welcoming environment. And despite that, and her husband being there with her to support her, I think she cried 3 times in our first appointment together. And you could tell, like, the fact that she was crying made her even more distraught, because like she knew that it was not a normal response, but she was just so stressed. Again, like 10 out of 10 anxiety, 10 out of 10 stress. And not coincidentally, she had whittled her diet down to about 10 foods, maybe even fewer than 10, but I think 8 to 10 foods. She was on a gazillion supplements. Like, I'm talking 40 supplements a day, perhaps. She had been on many years worth of antibiotics because of Lyme disease. And she came to me very, very anxious and very, very stressed. And over the course of a couple of months, we managed to reintroduce the vast majority of foods into her diet. We worked on her gut. Her diversity was just absolute awful. And I say that with love, but we worked on her diversity. We got some of her good bacteria fed. We got her nutritionally replete again, so she wasn't deficient in everything. And her anxiety did dissipate. She still had a bit of it, but it went from like a 10 out of 10 down to like a 3 or 4 out of 10 in a matter of a couple of months. Similarly, a good friend of mine had a wicked case of SIBO when we were in grad school, and nobody knew, because back in the day, we didn't know what SIBO was. And it wasn't until a few years later that she got appropriately diagnosed by a functional medicine doctor. And she still recalls years later, she said when she took that first round of Xifaxan and neomycin, her anxiety and her stress, which she would have rated at like 9 or 10 out of 10 for years and years prior to that, within the span of a couple of days, or certainly that first 10-day round of antibiotics, just her anxiety just melted away. She's still a little bit of a high-strung person, and she's one of my best friends. I feel like I can say that. Ginny, if you're watching this, you know this. But it really helped tremendously. Like, she went from 9 or 10 out of 10 anxiety to like 2 out of 10. It's still kind of a thing, and if she has some gut dysfunction or she has shitty sleep, it pops up again. But it's not nearly as bad as it was, and it really dropped like a rock very quickly. Another case, not to bore you with case studies, but there's another woman who stands out in my memory. We talked about SIBO a lot. I don't think we ever got an official diagnosis, come to think of it. But one of the things that stood out to me about her history was that she was otherwise pretty okay, and she did not have anxiety at all until she tried this like internet fertility treatment where you take a high dose of a PPI and high dose Claritin for 30 days, and then you're supposed to get pregnant. Obviously, you would need to have sex and do stuff like that. But she was trying to get pregnant, and so she took a pretty high dose of a PPI and Claritin for 30 days. And then when she didn't get pregnant, she discontinued. She just went cold turkey off of everything. She got wicked rebound reflux. And she got really bad anxiety and panic attacks to a point where she could barely leave the house. It was really huge that she was able to come into my office physically and sit for an appointment. She wasn't able to work. She wasn't able to go grocery shopping or do anything. And within the span of about a week of doing some antimicrobials and some anti-yeast stuff, not only was her anxiety a lot better, I don't know if I got a number rating from her, but it went from a 10 out of 10, cannot function, cannot leave the house, to within a week or two, her husband reached out to me and said that she was going to a co-working space and she was working on her business again, and she was able to go out in public, and not only be out in public, but she went to a co-working space, pre-COVID obviously, and she was like in a big room with a bunch of other people and a bunch of noise and a bunch of activity, and she was able to talk to people and interact with people in a matter of a couple of weeks. It is freaking wild when this kind of stuff happens, but it does all the time. So if you are struggling with anxiety or profound fatigue, that's another one that we'll do later on. If you are dealing with neurological ramifications of what you believe to be SIBO, please just know that there is a light at the end of the tunnel, and it can be greatly, greatly helped if you start to really unravel the SIBO itself and treat that and get your motility up and running and really give this poor vagus nerve some TLC. That's something too, is I don't know how much of the anxiety I see with SIBO patients is because of these mechanisms that I described, or if it's just because fried vagus nerve is like the most common diagnosis with all of my patients who have SIBO. That's not an official diagnosis, obviously, but I see so many of my SIBO patients and my IBS patients, and I think, boy, if there was a way for me to get some sort of numerical assessment on your vagus nerve, I guarantee yours is not functioning well right now. And it goes back to things like just getting outdoors, getting some movement, getting some joy in your life, having hobbies, stress mitigation, meditation, yoga, I mean, arts and crafts, whatever it might be, getting a dog. There's so many things that can facilitate and heal the vagus nerve. And that is something that, in my opinion, every single SIBO patient needs to focus a lot on the vagus nerve. But it goes totally over, just not even on the radar. It's like on another planet away from the radar in the conventional medicine space. And if a functional doctor mentions the vagus nerve, it's usually with this like, oh, just gargle. Gargle every day and your vagus nerve will be fine kind of attitude. And it goes so beyond that. I'm going to do a vagus nerve series coming up really soon. And we do have a whole episode on the IBS Freedom podcast about the vagus nerve. But please know that there is a layer of vagus nerve dysfunction and an imbalance between that rest and digest and that fight or flight side of the nervous system that really can make you settle into that anxious space much more readily, and then you can get quite stuck there. So you might need to pay quite a lot of attention to your vagus nerve and do a lot of things that you would think of in like the therapy type space and like stress relief space, but also treating the gut, treating the SIBO can really, really, really profoundly shift your anxiety in a very short amount of time. The other things for this, if you're looking for Band-Aids, like we said in the last video, you could do things like restrict your diet a little bit for a period of time, certainly making sure that you chew and you take some enzymes. Really getting to the root cause of why you got SIBO in the first place is tremendously important. Some of the other things that I really like for anxiety, though, if you want to sort of Band-Aid that symptom for the meantime, I cannot overstate the importance of psychotherapy and how profoundly helpful that is for many of my patients. And even just following Therapy in a Nutshell on YouTube or The Holistic Psychologist on YouTube and Instagram has been so helpful for me personally. For supplements, some of my favorite supplements are CBD oil. There's several good ones. I've been using Aspen Green recently myself, and I have also tinkered with Charlotte's Web, which is quite good. What I noticed with myself and with others with CBD is that you need a fairly high dose. So don't be bashful on the dose. I didn't realize for a long time I was underdosing. It wasn't up until I got to the 20, 30, 40 milligrams of CBD per dose range that I really started noticing an effect. But CBD oil can be very, very beneficial for anxiety and sleep. I also really like these lavender essential oil gel capsules. The ones that I get are called Lavender SAP. I forget the brand. If you can't find it for some reason, comment down below and I'll try to find it for you. But it's just called Lavender SAP. And they're these little teeny weeny gel capsules of lavender oil. And I have found that those are really helpful for anxiety and also sleep for a lot of people. And then the last herb that I really, really love for anxiety is kava. There's a nice product from MediHerb called Kava Forte, although there are others available on the market as well. There's some kava drinks, and kava can be really nice for unwinding the nervous system and taking anxiety down a couple of pegs as well. My camera battery died on me. So in closing, if you are struggling with anxiety as it relates to SIBO or hypothesized SIBO, here's what you can do. A, you got to treat the SIBO, and you've got to treat the root causes of why you had SIBO in the first place. Otherwise, you're just going to be stuck in this shitty loop for God knows how long. So treat the SIBO, treat the root causes. There's lots of videos on this channel about that, so I won't go into it in detail right now. You might consider focusing tremendously on the vagus nerve. Again, in my opinion, every SIBO patient and every IBS patient should be focusing a lot of their effort on the vagus nerve. But don't think that you can like force the vagus nerve to do your bidding. It's not like that. You have to just try to foster an environment that will make the vagus nerve happy. And a lot of that comes from things that we would normally associate with stress reduction or stress management, things like meditation and yoga, outdoor time, playing, arts and crafts, hobbies, hugs, things like that will go so much further as opposed to just try to force your way to vagal nerve health and trying to gargle until you can't gargle anymore. That is just one of my ultimate pet peeves. So please, please, please try to give your vagus nerve some TLC and some understanding and some space to heal. And then if you have inflammation, treat that. So if you have high C-reactive protein, homocysteine, glyce A, reverse T3, sedimentation rate, the list goes on and on. But if you have high inflammatory markers, go ahead and treat that. You might need to do a wicked high dose of something like turmeric or green tea or resveratrol to just get the inflammation down, because those inflammatory cytokines are going to hitch a ride up to the central nervous system and create more of the dysfunction and perhaps more anxiety. And if you're not treating the inflammation, you might be stuck in this perpetual loop. So treat the gut in and of itself in whatever way you need to based on your root causes and what is going on with your gut and your microbiome right now. Give your vagus nerve some TLC. Consider anti-inflammatory support, especially if you have elevated inflammatory markers on blood work or testing. Consider some of those herbs and supplements that I mentioned for anxiety, and go ahead and follow. Two of my absolute favorites are here on YouTube. There's a channel called Therapy in a Nutshell, and another channel, The Holistic Psychologist. I cannot recommend them enough. And actually, there's a third one. There's another one called Don't Hate Your Guts. So go check out those channels. I will try to link them in the bio or in the doobly-doo down below. So go check those out, but give your vagus nerve a little TLC, and I think that your anxiety, you will find, will be tremendously improved in no time. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.